This lecture is part 1 of the Biomechanics of the Foot and Ankle for the Level 3 Lower 2010. We're first going to take a look at the mechanics of the talocrural joint. To classify the talocrural joint, it is a compound synovial modified cellar. Therefore, it has essentially 1 degree of freedom, but it does move through 3 planes osteokinematically. The closed pack position is dorsiflexion. The loose pack position is 10 degrees of plantar flexion. And the capsular pattern is a greater limitation of plantar flexion more than dorsiflexion. This slide shows us where the actual talocrural joint axis is. On the first picture on the left, the axis is approximately 84 degrees from the midline of the foot and approximately 80 degrees from the long axis of the tibia. So looking at this axis, it's an impure swing about an oblique transverse axis. And the primary movements that are occurring at the talocrural joint are going to be dorsiflexion and plantar flexion. Typically, we have about 24 degrees of dorsiflexion and 24 degrees of plantar flexion. In order to have a normal gait cycle, 10 degrees of dorsiflexion is required and 14 degrees of plantar flexion is required. Because the talocrural joint axis is in an oblique plane and produces movement through a triplanar motion, plantar flexion will be associated with some inversion and a little bit of adduction and internal rotation. Dorsiflexion will be associated with some eversion and abduction and external rotation. And there's a small amount of posterior translation, about 9 millimeters worth. Arthrokinematically, with plantar flexion, we are going to be assessing anterior translation at the talocrural joint. With dorsiflexion, we'll be assessing posterior translation. Now let's take a look at the subtalar joint. Let's take a look at the joint surfaces. The posterior joint, the superior facet of the calcaneus is convex, and the undersurface of the talus will be concave. At the anterior joint, the surface of the calcaneus is concave, and the surface of the talus will be convex. And quite often this anterior joint is a bipartite or split articular surface. We classify this subtalar joint as being a synovial compound joint. Each of the 2 joint surfaces, anterior and posterior, are modified ovoid joints, but together function as a modified sellar joint. So osteokinematically, we have 1 degree of freedom of motion, but because of the axis of the subtalar joint, it'll be termed in 3 planes. It is an impure swing about an oblique axis, which is 42 degrees off of the ground and 16 degrees off of the midline of the foot. The combined triplanar motions are with eversion, a small amount of dorsiflexion and abduction, and with inversion we get a small amount of plantar flexion and adduction. The end feel of this joint is capsular. The capsular pattern would be a loss of supination more than pronation. The closed pack position is end range of pronation or supination, and the resting position is the mid position or neutral position of the calcaneus. Let's take a look at the arthrokinematics of the subtalar joint. Here we're going to use terms pronation and supination. Pronation refers to the foot becoming a mobile adapter or the flattening of the midfoot. The calcaneus is in a position of eversion or everting. This produces a lateral glide of the anterior facet and a medial glide of the posterior facet. With supination, the foot is becoming more rigid, developing the arches to prepare for push-off. The calcaneus is inverting, so we have a medial glide of the anterior facet and a lateral glide of the posterior facet. Now, during the contact phase, at initial contact, the calcaneus is in inversion, and the internal rotation of the leg will cause the talus to glide inward and downward. And because the rear foot is constrained, the movement of the talus will cause simultaneous eversion of the calcaneus. This results in the talocalcaneonavicular joint and the calcaneocuboid joint to be positioned side by side, making their axes more parallel, and this allows for the midfoot to unlock and the fanning motion of the midfoot and forefoot to take place, making the foot the mobile adapter that it should be. The term for that motion is pronation, and pronation of the rear foot causes increased mobility in the midfoot and the forefoot. During the propulsion phase, we're going from mid-stance to toe-off. Leg external rotation will drive the talus to glide outward and upward, and since the rear foot is again a constrained system, the movement of the talus will cause simultaneous inversion of the calcaneus. As the calcaneus inverts, it brings the talocalcaneonavicular joint and the calcaneocuboid joint to be positioned on one on top of the other. The axes now become divergent, and this develops or creates the medial and lateral longitudinal arches of the foot, placing the foot in a supinated position, allowing for effective push-off during the gait cycle. Therefore, supination of the rear foot, i.e. inversion of the calcaneus, will cause increase or results in increased stability in the midfoot and the forefoot. This is part 2 of the biomechanics review of the foot and ankle. We're now going to look at the midfoot and the forefoot. The first area that we want to review are the tarsal-metatarsal joints, and I'd also like to include in here the intercuneiform joints. Essentially, these are all planar surfaces of the cuneiform bones articulating with one another and articulating with the metatarsals. Because they're planar joints, arthrokinematically, when they go through the motions of pronation and supination, the cuneiform bones are essentially going to be fanning and folding. So fanning will help to flatten the arch out, and that's what we get with the movement of pronation. With supination, we're going to be creating or developing the arch of the foot, and that will become a folding motion. The movements of the tarso-metatarsal joints are essentially going to be plantar flexion and dorsiflexion, and there may be a small amount of abduction, adduction occurring of the first and second metatarsal and the fourth and fifth metatarsal during pronation and supination. So let's look a little closer at the first ray. This is a diagrammatic representation of where the axis of the first ray would be. The first ray includes the tarso-metatarsal joint. With plantar flexion, we will have an associated amount of internal rotation of the first ray, and that's in respect to the midline of the body. With dorsiflexion, we will have some associated external rotation of the first ray. Arthrokinematically, with plantar flexion, there will be a plantar glide associated with the internal rotation. And with dorsiflexion, we have a dorsal glide associated with external rotation. The fifth ray articulates with the cuboid, and it's theorized that this will be a triplanar motion that will occur with the fifth ray, and this is a diagrammatic representation of where the axis is. So the key movements are definitely going to be dorsiflexion and plantar flexion. The male, or the surface of the fifth metatarsal, is the male surface. So if we are looking at dorsiflexion, arthrokinematically, it should be a plantar glide which is occurring on the base of the cuboid. Along with that, there's going to be a small component of abduction and eversion occurring at the fifth metatarsal. With plantar flexion, we will see a small amount of adduction and inversion. And because it's a male surface, we should be seeing a dorsal glide. The axes of motion for the second to fourth rays lies pretty much through the articulation of the tarsal-metatarsal region for each of these joints. The primary movements are dorsiflexion and plantar flexion. With dorsiflexion, we will have a dorsal glide. With plantar flexion, we will have a plantar glide. The next joints that we're going to look at are the metatarsal phalangeal joints. These are modified ovoid joints with 2 degrees of freedom of motion. The closed pack position is full extension, which makes sense when we think of the gait cycle, that when these joints are maximally extended, we are going through push-off phase of gait, and we need the foot to be a rigid lever. The loose pack position is 10 degrees of dorsiflexion. The next joints that we're going So the axis of movement for plantar flexion and dorsiflexion is a axis that goes through the metatarsal phalangeal joint line. With plantar flexion, we will get a plantar glide. With dorsiflexion, we get a dorsal glide. The axis of movement for abduction and adduction, and again abduction and adduction are termed in relation to the midline of the body. With abduction, there will be a lateral glide, and with adduction, there will be a medial glide. The IP joints. The last joint is the IP joints. These are simple modified sellar joints with a 1 degree of freedom of motion. That is going to be flexion and extension. With flexion, we get a plantar glide. With extension, we get a dorsal glide. And that's all that we have for the mechanics review of the foot and ankle.